I'm Jenelle Hoseus. I am the CEO for the Central Ohio Pathways Hub. Could you guys please introduce yourselves?
I'm Tori Owens. I work for Physicians CareConnection, and I'm a CHW and also the care coordinator.
Hello, my name is Patrice. I also work at Physicians CareConnection. I'm a CHW as well as the drug treatment care coordinator.
Thank you. And how long have you both been CHWs?
A year?
I actually went to the Ohio State School of Nursing, so I graduated in 2019.
Oh, well, only a year for me.
And what inspired you both to become CHWs?
You want me to go first?
Yeah, go ahead.
Well, I was approached with the opportunity some years ago. And at the time, I was doing a whole lot of stuff, just doing a lot for a lot of individuals. And one of the young ladies who went through the class at Ohio State recommended that I take the class. She said, "You're doing the work anyway. This is what you do. So you might as well go ahead and get certified so that you're able to do it on a broader spectrum and reach more people."
What inspired me to be a CHW is one, me just working various medical jobs that I did, and I really seen the need. And I just felt like as an individual, I wanted to do more within the community. So I wanted to become more educated, and knowing that there was a lot of resources I personally was not aware of, and that I wanted to be able to assist someone else that may not know.
That's awesome. You both really have a passion for helping individuals who are experiencing homelessness. Would you be willing to tell us a little bit more about what you've done in this space and why you're inspired to do that work?
That's such a broad question because
It's loaded. It's a loaded
Yeah.
question.
there's a lot of entities to that question. I got exposed to more homelessness as I worked as the care coordinator here.
Yeah.
Knowing that there were different aspects to how people were not treated correctly and how they were put out on the street and what you can do and what you can't do for them. And when you have one moment of I have everything together and all of a sudden I have nothing and there's nobody for us to talk to us about it, and being able to give them the resources and get them at least established somewhere that we can actually help them with other things, other aspects to help them to get out of the situation that they're in. So that is the basic. That's just a basic. I say a basic where it comes from because it's really a lot to really get into, and it's like a tearjerker. It's like one of those good movies. Like, okay, in the beginning, it's a beautiful situation, and there's something there's that you hit that bump in the road, and then you don't have that individual that can advocate for you or even give you the information that you need so that you can be a sustainable individual. And then you're down, and then you find somebody who comes in and they want to help you, and then you get on this good road, and then you get them out of this, and then you're excited again. So then it just keeps going on. So it's a constant uphill battle. And I just enjoy that part of that part of it.
Adding to what Tori, just understanding what's being seen, because if me seeing in that hospital aspect is totally different. You really don't see the inside, of people's life. You kind of just see just a small fraction of it. But like Tori was saying, working here at PCC, actually inside, really, what's the word I'm looking for? Yeah, just more hands-on, with the clients, and actually building that trust for them to really be honest to see how you can assist. But it also makes me want to just do. So honestly, you said it.
So what's one thing that you learned from your work that you wish that people knew about individuals experiencing homelessness?
Giving people grace, understanding that things happen. Like, we're all human. Like, the pandemic has shown, like, we all need grace within this process, and that everyone needs help. Everyone.
Everybody is one decision away from being in that same situation. You never know the outcome. You never know what exactly took the place of that individual from being a happy, healthy individual to a place where they are right now. So everybody's one decision away from it.
Yeah. I agree.
That's really profound. That was awesome. Do you have any upcoming visits or work planned with individuals experiencing homelessness in the future?
So I've been working really closely with Comp Drug, and I've been able to be exposed to doing community outreach. So we have a camp outreach coming up, I believe July 15th. I believe we're going to tackle the east side. Last time I think we went on the south side of Columbus. So I'm excited. But I know PCC right now, we've been
we're proposing information.
Yeah.
We went after we went on our one excursion out and seen everything. So we came back on fire. So we wanted to involve everybody at PCC on what we've seen. So we've been going around getting things collected so they were able to go out and be a blessing to whoever needs it, to talk to them, give them the resources. And even if it's just what we're giving in the bags that we're trying to put together so that we can give them some start and some, let them know that somebody does care and that we're out here to help.
Yeah, it's definitely different when you're talking to somebody on the phone than when you're actually out there in the community. So it's a great experience.
That's awesome. I feel like I keep saying that over and over again. That's awesome, but it really is awesome. This isn't one of the questions that were originally posed, but just out of curiosity, I recognize that probably the first step is just making inroads to say, hey, we're here and we're available. But if you could pick, what would a long-term goal be in working with individuals experiencing homelessness?
The main goal is you want to see them off the street, but you also have to understand that some individuals, that's where they want to be.
Yep.
So we have to meet them where they are.
Exactly.
To get them where they want to be. Because not all of them want to be a part of society with all the politics and everything that's going on and how they can get this and how they can do that and how they have to answer to this and how they have to answer to that. And they're comfortable where they are. And I've never seen a community like we seen when we went out there. I mean, they had more stuff in their place than I do in my own home.
Yeah.
I'm like, because I don't want it to be cluttered here. I don't want to be they had beds, they had refrigerators, they may not really be refrigerators, but to them, it was their refrigerator. They had their stove, they had their things that they had to make them sustainable. And they just needed a little bit of help to get just other resources. So just meeting them where they are to make sure that they're sustainable and that they're happy.
Yeah.
And to be honest, some people, just coming from the drug treatment aspect of things, some people are not aware. They're really not aware. They think, the lifestyle that they may live is a-okay. But sometimes it takes a special individual that is patient and more understanding to kind of break things down to them. It's like, hey, mental health, we already know that's a big thing in our community. So, and homelessness, that just tacks on top of it. So just honestly, just like Tori said, meeting them where they're at and just understanding mentally, just physically, and just understanding their need. And I know mental health has been a big thing of something that I've been faced with a lot of my clients, especially when them struggling from homelessness.
Great. So a little bit of a change in direction, but have you done any work specifically around COVID-19?
Well, specifically with our clients, we always educate them on the importance of making sure that there's doing what they're supposed to do so that nothing happens. So we always try to give them cleaning supplies, masks, disinfectants, anything that they can do to make sure that they stay as clean as possible. Wash your hands, educate, we talk, have conversations. We hit on what they want to talk about because not a lot of people really still want to talk about the vaccine, but we let them know when they're available. Then when I talk about the booster, we still let them know when that's available. We say, when you're having people come in the home, still safe spacing. I know everybody doesn't. We also let them know, hey, you can get free COVID testing. Yeah. All you gotta do is they come to your home. All you gotta do, you want to have a get together, have everybody bring a test to make sure you guys are good. We just have those conversations with them. I have kids, I got grandkids. I don't want them sick. You don't want to be sick. I had it. I don't want nobody to have it. It wasn't cool. So that's the kind of conversations I have with them. Like that's some real stuff. Yeah. Mm-hmm. It's no joke. And I'm just letting them know. And I'm fully vaccinated.
Yeah.
So I'm like, it's not picking and choosing. This is something that's real out there. No matter how you feel, this is something that's real. I just want to make sure you stay educated and where the resources are. So we talk about it every chance we get.
Yeah. What Tori said.
Have you seen any evolution in people's perspectives or their reception to information about whether it's the virus itself or vaccines in the last year?
It's an up and down, honestly.
Yes.
I do have some clients who are like, oh, this is a real situation. I'll do more research. I'll think about it.
Especially our pregnant clients. That's why I don't think it's safe. And I can sit here and educate them till my face is blue. I can give them the CDC guidelines link and specifically says, and they're still like, I heard my friend had birth defects. I heard this person. I'm like, okay. what's best for you and your baby. But here's the information. I'm just going to provide it to you. So
I actually did the same thing with my little sister. She's convinced that the vaccine is going to give her a higher propensity for a miscarriage. And I was like, so I'm not going to convince you that you should do this, but just read this.
right.
One of these.
Yeah. Definitely keep them open-minded, but
all you can do sometimes. So what does being a CHW mean to you?
An advocate. I would say someone as an advocate. Being that peer. I really would say you have to be that peer. And I know this may be kind of, but in this type of field, like being a CHW, you have to be unbiased. Like, because what your beliefs is different from someone else's belief, and you just have to be open-minded to. And I feel like you got to be all those things. Like, you got to be a special person to want to tackle, these barriers. And even when you got clients that are hard, you still have to be willing to be patient is number one, and still give them grace and know that, okay, this is going to be a hard cookie. So be patient. Definitely have to be patient as a CHW.
Anything else? Everything she said? Okay. What is your favorite part of your job?
Ooh, accomplishing goals. I'm talking about the harder ones. Like, I'm talking about, I don't know, this question just really excited me.
Really? Mine is meeting new people. I mean, it's meeting new people and learning new things.
No, the only reason why I said, meeting new people, that's fine. Okay, great. We do that. But I'm talking about when you get those real hard cases and you're like, how as a CHW am I going to be able to truly tackle? Because this person came to me and said, I need help. So they're expecting me to help them. So when I go through all these resources and I'm tackling, calling this person, that person, and just the outcome that 1, this client is in their home, 2, their stress level is down, 3, they feel like they're stable and able to, be a better parent, to their children. Man, that's overjoyed. I shout every time. I'll be like, oh, bro.
I love that. I love that.
So I get excited because I know how it is to go through the trenches, especially alone and not have that support. So to be able to be that support for someone else, it's just overjoyed. Oh my God. Man, I could just smile.
That's incredible. So how would you describe your work as a CHW and the impact on the community?
Let me say,
At the same time, because it's a catch-22. Because there is so much in the community that has not been tackled and touched, because we're a few and far between community now that we're growing. So the steps that we are making are footprints for individuals that's going to come behind us to make bigger steps. Like my son would say, don't tell me that there is what's on the moon and there's stars above the sky, and we can reach for the sky and we can reach for the stars. I don't want footprints, I want stars. So I want to go bigger. I want to see bigger. I want to hear bigger. I want to feel bigger. But I also want to know that as CHWs, that the appreciation of what they're doing is met as well. Because sometimes as a CHW, you go home and you are just drained because you're just like, oh my God. And you're still thinking, okay, I could have did this, and this for that person, and this, and this, and this for that person. You're like, can I get some more resources from here, and the collaborations are beautiful. So then that we're opening up doors and people are walking through doors and they're not afraid to walk through doors because they say, hey, such and such said I can do this. They're like, yes, you can do this. So you're making bigger impacts for individuals that will know how to navigate through these situations if it ever comes again. So, okay, let me sit down and think about what I did the last time so that I don't get where I am, so I don't go back to where I was. So I think that what we do is give people hope.
Yeah.
Give them hope.
Definitely hope.
We give them courage. And we give them love and support. I know, I'm sorry, I love my people. All love them. I love all my people.
I definitely would tell my client, I love you, girl.
So much. I'm so proud of you. I'm a cheerleader. Hey, I can't do the splits. I can sure cheer you on. So I think that's what it is. We're just we're the underdog that is right there with the individuals that are making bigger steps for the people so that they can make the steps for themselves.
And sometimes we are the the one and only person that they may know that is connected to that community. So it is nice to be that connection for our community and be like, hey, this is out, because again, technology, not everyone has connection to that, or or hearing it by mouth or anything. Not everybody knows everything. So to be able to be the advocate for them, I love it.
Well, we love you guys. And I just want to say, from my perspective, you guys are already meeting the stars dynamic, because you don't know, you're doing incredible work when it comes to the hope and the love and the being the person that's connecting folks. But what you don't see, at least probably not likely on a daily basis, is the generational impact y'all are making. And that to me is the stars, right? Like that to me is saying, yeah, you made the footprints and people are going to walk behind you and you have led the charge in making the impact for that person. But what about their kids? What about the people around them watching them succeed? What about the neighbor down the street that knows it's possible, or knows that there's now a place that they can turn to? So to me, that is you guys getting the stars. And so I just want to say out loud that you've already
You're gonna
done
make
it.
us cry on this kid.
We ain't no good. Good Lord, Jesus.
That's the stars.
Because we don't, expect anything. Just knowing when I lay down at night, I know I did the best I can, and I know someone is off the streets.
Absolutely.
So that means a lot, coming from you, Jenelle, and I appreciate that. Like I really, really do appreciate that. So
I mean, every word. It's the least I can do is to tell you guys that you are doing the work of the stars. So.
I appreciate that, because we still feel like we
ain't doing nothing.
We ain't doing nothing. Like I feel like we have not like really hit like our potential as CHW. So I know we're really hungry to just know more, do more. So I appreciate that, and that just lets us know, give ourselves grace and a pat on our back to know, hey, don't be so hard on yourself. So we need to.
If you guys ever need that grace or a pat on the back, I got 2 hands. I'm ready. I'm ready.
We thank you, Jenelle. Oh my God, we thank you so much.
All right, 2 more questions. Often housing referrals coincide with other pathways. Can you share a story or 2 about a client you've connected with for a housing referral, and what other services you've been able to connect them with? Without naming names, obviously.
Oh, yeah, gotcha.
Of course. So I had a client who was struggling with substance abuse, and to fast forward, I was able to get this client connected to drug treatment. She completed successfully within the 30 days, stayed clean. I was able to get them connected to rooming housing. They're still in rooming housing as well as clean. I just spoke to her I think it was like last week or so. So I'm really overjoyed, because all she could say was thank you, Patrice, for just being patient, for being just understanding. And there was other things, food pantry, identification, all those, basic, but her main need was being clean and getting in a different type of space. So I'm just happy.
That's amazing. That's amazing. I mean, because the propensity to stay clean, if you don't have a safe space to be clean in.
Yes. You're bound to relapse.
Yep. You're going to go back to the places and people that you knew from that time, you know? So
she definitely understood what recovery meant for her.
Yeah.
And I know all of us are dealing with recovery, maybe not be substance or mental, but we're all dealing with some type of recovery, within our life that we're trying to heal from. So yes.
That's amazing work. Bravo. Tori, you have anything?
I had 2 clients in Colonial Village that are thank you out of Colonial Village. One of my clients who got out 1 week before she gave birth to her new baby. 1 week, and she lived in Colonial Village without a refrigerator for 6 months. She had no heat for 2 months. She has 2 older children. She's high risk. She was in her 40s. I'm in the middle of the winter going to get heaters and things so that they can stay warm. The bottom of the home flooded, so all that is gone. So they were living in the upstairs of the townhome. But all B to just making sure we stayed, the Section 8 voucher, I had to go through the hoops with this one. I mean, I'm writing letters. I'm like, wait a minute, we got to make sure this is done. Why was this done? Why was this ball dropped? And they're looking at me like I'm crazy. I'm like, my lady has to have this baby in a home where he can be a little person. He don't need to be up here trying to fight before he even knows how to even suck on a pacifier. So they're looking at me like I'm crazy because those are the conversations I'm having. We got her in to a new home for her children. Got them in her one daughter. They couldn't put her in school, so now that she's in school. So she's doing amazing. The baby's doing amazing, and that was one of the hardest ones. The other young lady who she got out, she had 4 kids in Colonial Village. They moved her. This is the crazy part. They have the new thing. They went in, cleaned up the apartment, said it passed. The next week, the city of Columbus went in there and said, this is a hazard. There's nothing clean. You just put paint on it. There's nothing going on. The rodents was coming in. They were sitting on the beds when the little kids went in there. So I had to get them out of there. So they, with the help of Impact, they were given a home, and they are in their homes till this day. So it's almost been 6 months that they've been out of theirs.
That's amazing.
Yeah, but Colonial Village, that was a tough one because of all the things that's going on with them and the system and how they're stopping and how they were already collecting money for individuals who didn't have any idea. So that was the biggest, that was the overcoming thing that we had to overcome. Like, hey, can't hold them accountable for something they have no clue on how it was taken care of. So yeah, they're out cooking and in their own little places and having a good time. Water balloon fights with the kids. They send me pictures.
See, look at that. That's stars. That's it. That's it. That's it.
Our pictures are
right.
Yeah, that's what had me excited. I even got together and we got them a Christmas tree. The one year
that's awesome.
The Christmas trees, and I went to a couple different places and got them Christmas trees and presents for their first Christmas in their home.
That's incredible.
So that was fun. That was fun.
That was definitely fun.
And I took my goddaughter so she could be a little appreciative of the things, and she had a ball helping them to put the Christmas tree together and give them gifts and stuff. So yeah,
definitely.
That's it.
Yeah.
See, and then it's not just the clients, it's also, people around you that get to see the impact too. And that's really just fantastic. The last question, what is one thing that you wish people understood about your work?
Woo!
That it's not a job.
Yeah.
It's a lifestyle.
It sure is a lifestyle.
That being a CHW is not a job, it's a lifestyle.
Yeah.
You have to honestly really want to do what we do. You have to have a passion for what we do, because you can't come in and say, I want to be a CHW or I want to be a coordinator. And then all of a sudden the hard stuff comes and you're like, oh, I can't do this. I quit.
Your yes has to say yes.
It has to be
even when it's the hardest.
Yes.
And that's what people don't understand. Your yes has to stay yes, even through the toughest times. And if you have answer questions, and ask them. But my thing is, number one, as a CHW, and I will hope to help some other CHW, self-care is a big thing. Like, I'm okay with turning off my phone and the whole nine. Definitely self-care is a big thing. But another thing is learning also that
just knowing that it's okay not to get everything all done at once.
Yeah.
Making sure you prioritize and you have a conversation with them to make sure that you're empowering them to do the work. It's not all on you, it's a teamwork. Like Patrice always says, teamwork makes the dream work. That's her life for everything, but that would be it. That this lifestyle it's wonderful. I feel like I'm empowered when I do this because I'm helping so many people, and just being able to help somebody and them say thank you. That is one of the most phenomenal things. Or I couldn't have done this without you. Just for them to realize that I'm not going to leave you and let you leave me before I leave you.
Right.
That's the biggest thing. You leave me before I leave you. And when you leave me, I want to make sure that you can do everything that you said you wanted to do.
Yeah.
So that's
like my boss would say, this ain't for the weak.
not for the faint at heart.
But also as CHW, I feel like we need also them understanding that we also as people need grace too. And we need understanding. as well. We don't know everything. That's why we go out and search, but just knowing that we just, yeah, what Tori said.
What you said.
We both are incredible, and not just as CHWs, but as humans. And we're not just lucky to have you in the hub, but to know you. And so thank you so much for all you're doing, not just with, individuals experiencing homelessness, but the zest and the love that you have for what you do and for the people that you serve is palpable. You could feel it, and it is an incredible thing to behold. So thank you both so much for everything you do and who you are.